Okay guys, so maybe you have been told that you have arthritis and you're not exactly sure what that is. I am going to explain arthritis in a nutshell. I am Dr. Brad Homan, board certified orthopedic surgeon. If you find this kind of content interesting, then please like and subscribe to the channel. So let me dive in. I'm going to be talking about primary, what we call osteoarthritis. There's another type of arthritis that is called inflammatory arthritis, and that would be like rheumatoid arthritis, and that's a more complicated issue, and that's beyond the scope of this discussion. But most people suffer from what we call primary osteoarthritis, and what that means is that the cartilage inside the joint starts to wear out. So I'm going to show on this little knee model here, at the end of the joints, you've got this thin layer of a cushion material. It's called cartilage, and it basically functions as a shock absorber in the joints, and it keeps your bones from hitting each other too hard when you're moving around and when you're walking and doing other types of activities. So that cartilage helps kind of like cushion the joints. Cartilage is also important for maintaining joint health, movement, stability, and things of that nature. So what happens with primary osteoarthritis is it's usually an age-related process where the cells in the cartilage, which are called chondrocytes, stop working as well, and they stop producing what we call the matrix, the substrate, the actual cushion material that the cartilage is made of. So the cartilage cells produce all that, and after they get to be a certain age, they stop doing their job as effectively, and then the cartilage begins to get weaker. And another characteristic of healthy cartilage is it's got a very high water content, and as you get older and the cartilage cells don't do their job, then the water starts to come out of the cartilage. It becomes more brittle, a little bit less effective, and then after that happens, the cartilage actually starts to fragment and it starts to deteriorate and float off into the joint. That sets off another like vicious cycle, because then you've got loose pieces of cartilage floating around inside the joint, and that kind of hits the lining of the joint, what we call synovium, and that creates another inflammatory process because the synovium doesn't like all those extra particles in there, so they secrete more inflammation, and then that inflammation gets into the joint fluid, and then that inflammation will start breaking down the cartilage and damaging chondrocytes even more. So as you can see, it's just sort of a downward spiral once it all gets started. Trauma can actually cause those cartilage cells to become damaged earlier. So there is a condition we call post-traumatic arthritis, which basically starts this process in younger patients. But at the end of the day, it's progressive, it's degenerative. We do not have a cure for this. And then ultimately, if it becomes severe enough, it's going to require a potential joint replacement surgery. So that's arthritis in a nutshell. So the question is really, how do we prevent it? How do we stop it from happening? How do I not need a joint replacement surgery? And the answer is the most effective thing you could do is lifestyle changes. And the first one is going to be low impact strengthening exercise, because your muscles support your joints. And the problem is nowadays, a lot of people are more sedentary than they used to be. And so those muscles aren't getting worked and the joints aren't being supported. So sedentary people or more sedentary types of people tend to get joint aches and pains more than patients that have an active lifestyle. Another potential cure or some way to prevent the arthritis from getting worse would be with your diet. And so there are a lot of foods that we eat that cause inflammation systemically. And if you've got an inflammatory problem like osteoarthritis, then having more systemic inflammation in your system because of the food you're eating is actually going to make the symptoms of that worse. Inflammatory foods would be things like added sugars, preservatives, other kinds of additives that are put into our food. So clean eating with a nutrient-dense diet is one good way to help prevent the progression of osteoarthritis. Another one would be activity modification. So if you happen to be involved in a lot of impact activity, that could be damaging the joints even further. So keep in mind that arthritis is a condition where the cushion in the joint is starting to become effective or becoming defective, and then that impact gets pushed onto the bone, and that creates a lot of the pressure and pain that patients will experience with arthritis. And so decreasing the impact on that cartilage will help offset those symptoms. So if you happen to have arthritis and you are involved in an impact type of activity, you might want to consider changing your activity around to still be active, but just do it in such a way that isn't going to pound on the joints quite so much. There is a role for medications, things like Tylenol or non-steroid anti-inflammatory medications like Advil, Aleve, and Motrin. Those medications can relieve some of the symptoms of our osteoarthritis. Putting a brace on for compression or potentially some support can help relieve the symptoms of arthritis, but the most effective things really are going to be the diet and the exercise program. So that is osteoarthritis in a nutshell. I hope you enjoyed the content. Please like and subscribe to the channel. I'm Dr. Brad Homan. My message, as always, just take care of your body and it will take care of you.